Good morning. Well, so as of January 20th, 2020, first recorded case of COVID hit the US. We're rolling into our second year and rolling out of the holiday season with the highest numbers, resurging again. In this episode, we will be discussing the role in which frontline workers have stepped forward, even when they didn't volunteer to, and the unsung heroes that they've been, what they've gone through. And yes, we'll step into an emergency room with Dr. Karen Scaglione as she discusses what this has done with her life, and where do we go from here. All right, welcome everybody. First, I have Cathy Davis. Cathy, she's putting together again, fellow publisher, as well as woman who's always bringing the great issues to the forefront. Her last book was on Ruth Bader Ginsburg, and now a book that you can get in on if you want, Rising with Resilience, which is all about the young unsung heroes that are from frontline workers. And Dr. Karen Scaglione. All right, let's get into it. So, first of all, what's frontline workers? Who are we talking about in this?
Yeah, we're talking about MDs, nurse practitioners, physician assistants, nurses, medical assistants, staff, first responders, as in police officers, firefighters, EMS, actually, as well as what we classify to be grocery store workers, people who had to keep people who had to keep businesses and companies running, pharmacists, pharmacy staff. So our CVSs, our Walgreens, all these places that never shut down when the pandemic hit us.
Your cab drivers, your Uber drivers. Yeah.
All the ones that
grocery delivery people.
Mm-hmm.
Ubers. Yeah, absolutely. Yes. All these people. I think the impact I know, it's affected everyone. It's affected everyone. And it is, I know it's still affecting everybody. I know for the most part, though, myself being practicing medicine, it has affected us to a deep extent in medicine, practicing and trying to keep our personal lives together, our families together, and then keeping our patients together and our healthcare system together. And it's been traumatic.
Let's go back, even though we're still here, right? Rolling into 2022. So, and you're okay. So, you are a nurse practitioner, emergency room. You are the front line for the medical industry, correct?
Correct. I'm a nurse practitioner. I also am a professor as well. So I'm in academia and I teach full time as well. So I saw it on both ends. I saw it hit the academic world and it hurt our students as well and faculty. And then I saw what it did to our patients in the emergency room and in the ICU and with our hospitalist team as well.
So we're on year 2.
Right.
When this first started to veer its ugly head, and you're saying it's actually, you're seeing symptoms, you're seeing patients as early as October 2019 without formally announced and diagnosed.
Right.
When this started, did you anticipate that it was going to turn into? What were your thoughts when it first started, when they first standing into seeing patients?
Mortified. My first thoughts were, we have a pandemic on our hands, and this should not have happened. I feel as if this pandemic came way too many years early. I actually I practiced in infectious disease as well. I've worked with some of the best here in St. Louis, and we had discussed in earlier years what a pandemic would possibly look like, and the fact that having one come this soon in history just seemed too far off. So when it first hit, the idea that it really was surreal at first. that this was, everybody was getting so sick from this. And then the death toll when it started happening, and then that's when it really hit us in medicine. And we became scared. We were not only scared for our families and friends, but scared to how are we going to keep up with treating all these patients? The trajectory of death and illness that just kept rising, and trying to meet that number, and the lack of beds and facilities. And it was very scary. It still is very scary, but that initial impact, it was a feeling of helplessness and where do we go? And let's mobilize. We, especially in critical care, tend to think about mobilizing first. Even though we get scared, we're like, okay, how are we going to place this in a triage system? How are we going to triage the sickest to the mildest cases and get to who needs our help the quickest? And I think for us, it wasn't just healthcare that initially had that huge impact. It was politics as well. It was a lot going on with trying to figure out where the direction was going, especially in the United States, with who were we believing? Who is the public going to trust? Where were we headed with all that? And so I think it has been 2 years, and we've come to this point where we were all hoping that we would get through the initial impact, and we knew it would probably be a year. And then we were hoping for vaccines, and now we have a booster, but yet at the same time, we have not conquered this virus. And I'm not sure, we tend to believe that this virus will eventually turn into what is more like the flu. Yearly vaccine, people still die from the flu. So we assume that this is going to be a viral illness that will take effect upon some more deadly than others. I'm not sure this will be something that we've seen impact through the course of centuries, where we've had polio and MMR and the Spanish flu and all those things, if you can remember back, that kind of died out. I'm not sure if that's going to happen with this virus.
Let's take you back. And I'm like, it's like the beginning opening of a movie.
Yeah.
And yes, you're the hero the heroine coming in. And you're walking in that day, right? You have your Starbucks, you're going in, and you're starting to see the patients, you're starting to see the sickness. At that point in January, because you're saying even like you went for let's do January, because you were seeing patients before. With that, knowing that at that point, that early part of 2020, the realizing we were in a pandemic, which is just what you stated, right?
Yeah.
And knowing that from being in academia and a professor,
Right.
what your initial was like, okay, look, this will only, was there a time frame? You're like, you know what, we'll get this done in and out. And hey, maybe 6 months, maybe 3 months. What was your first reaction to that and the timeline?
That was my ideal reaction of, I should say, that was my concept of quote ideals of, I hope that this doesn't last very long. And I hope that we can, as healthcare, we can come in and we can fight this and we can contain it and we can stop it. I soon found very quickly that that was not going to be the case. Our cohorts, we all looked at each other. And I remember with tears in my eyes, looking at one of my cohorts saying, what is going to happen to all these people? What's going to happen to us if we get sick with this? And he's like, he looked at me, and for the first time, this is a person who was so stoic and said, we have no control over this anymore. We are doing the best we can, and we're staying in the water with life jackets, and that's all we can do.
So let's take this back as the individual, right? Because when it comes to the frontline workers, so much that first it was thrusted on you. You didn't volunteer. I mean, as a doctor, you took oath to continually taking care of people and bringing them forward, right? Sure. However, you didn't sign up for this. And in that initial, were you also scared that you had your protection, right? Well, there wasn't enough masks at the time for medical as well in some places. Were you scared of possibly getting sick or bringing it home to your family?
Absolutely. Oh, absolutely. We reused our mask quite a bit. And yes, Being scared was actually a very mild term to use. Again, mortified, full of anxiety ourselves. I would strip down my clothes in the garage before walking in to the house, scared I was going to give it to my mother, who's 82 with comorbidities. And more importantly, my daughter, who is 8. But for me personally, the impact came too, as well as I was actually going through a divorce at the time. So the idea of leaving my child behind and getting sick was very terrifying. My child needed me. And so it was very, and the words were, a lot of tears were shed, a lot of tears on many, many nights, and just praying for the best, praying that God was going to watch over all of us and that we would be okay. But I never stopped practicing. That's what I took an oath to do, as well as be there for my students in academia who really had a lot to deal with, as well as the whole concept of what they were learning was changing. They, not being on campus, everything was by Zoom, and it was difficult for them in the height of a medical program when they needed that comfort, and those instructors, they had to fend a lot for themselves. So it was tough there too.
So we talked a little bit before we went on camera. So what you were describing, and I want you to get into that, lean into it. It comes to mind almost like a MASH scene where you were consistently bringing the bodies in and sorting them out. Who gets first treatment? Who's least to most sick and in danger of dying? Go into that. What was that like, and how long was that for you and your fellow workers?
Yeah, one of the most poignant times I can remember when that started taking place was being in the ICU, having come from the ER and being in the ICU again, new, and working with such, I have to say, fabulous providers and staff that came to the table to do the best care possible. But we would stack 2 patients to an ICU room. We were proning them and supining them, and we didn't have enough rooms and beds. So we had to put 2 in a room together. And that's not really heard of in the ICU. We don't do that in a lot of bedrooms in the hospital anymore. We tend to, everything's a private room now. And so one of the worst nights I think I remember was having 5 or 6 patients die that night. And then watching them rotate. We would rotate, the bodies in and out of the room and put another patient in, and then flip and prone them and paralyze them and sedate them and pray that maybe they'll start breathing better. And that was at a moment in time when it first hit me. I'm a strong person, but I was like, this has weakened me. I felt helpless. I felt like, as you described, a MASH scene. I felt like we had this invisible enemy that was attacking from all sides, and you couldn't see it. You didn't know when it was coming, and you didn't know when your patient was going to crash or if they would take the turn for the better. And it felt like it just stripped away all the science and all the things that you've ever learned in medicine. And there are moments where you didn't feel calm, you didn't feel secure, you felt weak and vulnerable, and you were fatigued and exhausted, and you felt like you didn't know anything anymore. You felt like everything that you had learned, you didn't know anything. You just felt like you were a bad provider, like you failed these people when they died, even though you didn't. But it took a while for us to spin that and see it. And I still believe now there are moments when I would come home from work and feel like, could I have done something different? Could I have given a different med? Could I have, could I have called the family sooner? Would they have more had time to talk? A lot of patients that we admitted from the ED that would come up, they would have markers that we would look at, blood markers and things that we could tell if that patient was going to take that bad turn. And so most of these patients, you'd be talking to and laughing with and trying to ease their anxiety. And before you knew it, they were dead in 24, 48 hours. You were busy calling their family members at 2 a.m. to ask them, you want to say your last words. So it was traumatizing. It still is. It brings tears to my eyes.
Yeah.
Well, it's we're still in it, but that time where time stopped. How long was that MASH unit environment, how long did that last for you?
I think it lasted probably about 8 months.
Wow.
I stepped out about after 6 months. I started rounding with the hospitals group. I got to a point when I was in the ICU, it became too damaging. It just became too much. And a lot of us stepped away. Several people, it was hard to take time off and to do different things because there was no staff. But I would say that trajectory of illness and death in that particular unit that I was in, it lasted for a good probably 8 months, if not greater, especially for some of the providers that were there practicing before.
And again, we opened up with that you walking in with your gorgeous suit, coming on set, right, ready to go. Nowhere in any of the depth of all of your education experience would you have like embraced that. It was 8 months of hell.
Yeah. No, you would have, we knew when we started seeing how sick these patients were, we knew they were going to be sick. We knew sick, but to the extent of illness on top of all like the comorbidities, what we talk about, they would have. So patients that have diabetes and hypertension, heart disease, immune issues, cancers, things that you had to juggle along with that virus. And that was one of the most difficult things, because with the science that you knew and the medications that you knew that originally would help these people, this virus defied some of that. And you had to think out of the box. You had to be abstractal. You had to learn to say, I remember a couple of my cohorts, I was like, we've done all this and we've done all this. And I remember a few of them, very skilled, well-educated. I mean, coming from the best universities and the best fellowships, were just lost at the bedside. We would just shake our heads and be like, we don't even know what we're doing. We felt like that at times.
Well, okay, and let's get into that a little bit. So on the outside, people's just staying in their homes, and that's another whole thing with children and what they went through, and full-time mom and educator all in one. The ideal patient, right? Not the ideal patient, but the normal patient, whether they're old or they're sick. And when did that start to shift that the typical patient was no longer the typical patient? You were seeing younger people die. And what did that look like when it could hit anyone?
Yeah, I saw patients my age, younger than me, with going through it, dying from it. And that started, I think when the virus first started, we concentrated on nursing homes that were becoming, and they had it and they were becoming filled with it. I think that the difference was that when you hit the hospital, it wasn't the elderly. They were there and they were sick with it, but it was your 50-year-olds. It was your 40-year-olds. It was your 20-somethings. It was your 30s. They were there at the thick of it too. It wasn't what people coined and termed an elderly illness after it left the nursing home. In the nursing home, of course, because those rehab facilities and nurses, they're full of the elderly patient, but the hospitals aren't, and we treat everybody. And so we saw it was a trajectory. It wasn't just, and it really wasn't people had this idea that you had to be obese, you had to be morbidly overweight, you had to have diabetes, you had to have hypertension. Well, that might have been the case in the norm for that first part of our patients that came through, but it really wasn't after a while. Everybody that was sick with it wasn't morbidly obese. They didn't have diabetes. They weren't all hypertensive patients with blood pressure issues. It became a mix. It became such a mix that in medicine, you always look for commonalities when you're trying to diagnose and do things. And at this point in time, it became looking at your patient and trying to figure out, God, they got this virus, but how did they get so sick from it? What is wrong with this patient that allowed them to be so sick from it? And some people came in with no health issues at all. They were getting sick and dying from it, and they had no past medical history that would have alluded to something like that.
So in other words, as a society, we can't just put it on a shelf and say it's just for these few people. It really, you did not know, as someone as really, I mean, you're in infectious disease professor, as well as a nurse practitioner in the emergency room. Is there not a particular set of criteria that this normally hit and get sick for and die with people? Did that change?
Yeah, so I've practiced in infectious disease, but I teach in the NP program, the acute care, critical care program, and doctoral. But from my experience with ID, with infectious disease, and just how what we've learned from this virus, and scientists are continually studying it, what we've learned is that as it got brought forward and it came, and I want to say landed, then we've noticed that all those markers that we used to look at, maybe, like I said, the morbid obesity and the hyper and all that, we've noticed too that that's changing. And then with this new virus, with the new variant, the Omicron, it completely changed. It's everybody. So it's hard to lock something down if you don't feel like you've got a grip on it when things keep changing with the epidemiology of it. And that's what's occurred is, and then I remember at one point there was a lot of stress upon the African-American population and saying that they were getting sicker from it and that it was mainly attacking their communities and groups. And it looked as if that could be the case initially. But then what we thought that was more a social determinant, might have been a socio-cultural economic issue, but it necessarily wasn't a virus issue, just a virus issue attacking. So there's a lot of change and concepts to be learned from this virus, and we're still learning it. And where it may continue to change and how it may continue to change, we don't know. The idea is to get ahead of it. And I'm not sure that we're being able to do that because of the world that we live in and how we've handled it.
That message that, and we're not getting it enough, is that the virus is no longer an elderly or immune compromised, that really it keeps jumping and that everyone is vulnerable to this virus. That's not being said enough. Well, or getting so, let me go in there on now again. So there was 8 months of hell, a mass unit, bodies piling up. At that, and you were going in protected as much as you can. When did you get access to, in that time, and I'm just trying to paint a timeline, when did you get access to the vaccine?
Let's see, my group, I think the group of critical care workers and first staff were able to get it in December, at the end of December of 2020.
So it was a full year.
Yeah.
Okay. So now that being said, a full year of going in with, PPE equipment and some of it reusing, which is not normally what would be. Did you lose any of your fellow staff? And how did you guys really protect yourself? And I'm going to have a twofold, not just protect yourself physically, because I want to go into that, but then we'll get into the mental and move forward with what's still working with that. Did you lose any fellow employees?
No one emergently in the ICU. We lost a professor. There was a professor who was lost. She was a women's health nurse in one of the hospital systems here in St. Louis, and she lost her life to COVID. She actually was finishing her doctoral degree, and 2 days before her dissertation was to be given, she passed away in the ICU. She was at one of the universities here in St. Louis, and I knew her as we used to teach, and then she was one of the cohorts of, her program. So she was about to defend for her doctoral degree, and her family. I remember the day she was supposed to defend for it and stand up and give the lecture on it. Her family called and said she had just died in the ICU. So that was probably the closest it came at that point to knowing someone that had passed away from it. And then we started to see staff nurses and other people's spouses get sick and die. There was an anesthesiologist whose husband died. And so it started to affect our community in much, it affected our community in a deep way enough, trying to keep our patients alive and be there for them and their family members. And it was hard. Families weren't allowed in hospitals at the time too, during that hell wave, you want to call it. And so I know how important family is at the bedside. We all do. And so to not allow that patient to have that was rough, really rough. So
that year before you got vaccinated, that the protocol of the PPE equipment and what you guys were doing, now that we're looking back, it did keep you safe. So what can we assess from that going forward as a society? Take from what happened in the hospital and bring that forth. What does that look like? Because that's incredible, and that it worked then. It did work. What did that look like?
Yeah, I believe the PPE did keep us safe. I think that we were in the battlegrounds and we didn't have anything else to use besides gowns, hair nets, your N95s, your surgical mask, and quite a few of us would take the surgical mask and place it under the N95. And some people would even triple up. Whether that there was science behind that at the time, there wasn't. We just followed the anxiety that drove us. We followed it, and we did what we did. And so I believe it did keep us safe. If you wore it right and you used it the right way, again, we had to use our mask over at times, but I think if you, and then we would place them in brown bags, and we would set them to the side with their names on them, or you'd carry it in your backpack with you. We weren't walking into these areas looking like we had rolled off a fashion truck with Starbucks in our hands. It was a day in and day out routine of, you were hair's back, you're covered, maybe makeup on, you're wearing scrubs. You are, a lot of our providers would change into the scrubs in the hospital and change back out. So they wouldn't, at that time, that was the height of it, where we thought COVID was on food bags. We thought COVID was on, it's stuck to everything. It's stuck to your hair. I would come home and wash my hair. I mean, people were taking their groceries and going shop, having delivered and dumping the bags out and taking them out of our packages. I mean, looking back, I'm like, that was insane. That was ridiculous. Why did we ever think that something could live? But again, we didn't know what we were dealing with. We had no idea how to deal with this virus in particular. And we were doing the best we could.
So the getting vaccinated, and we're going to get into Omicron in a second here, but so what worked in the hospitals is what basic things can we take out into the real world that worked to keep you safe in the hospital? What does that look like? Are we just talking masking? Are we just talking washing our hands?
Absolutely. Masking right now, and definitely washing hands. Carry tissues with you. If you sneeze and you don't want to use it, sneeze into your coat, sneeze into your sleeve. We always say sneeze into your arm sleeve. Stay home if you're sick. Stay away from people if you're running fevers and you're sick with stuff. I will have to say, there's a group of us that we're always talking about. The one thing that we see coming out of this pandemic is for people to be cleaner. You don't realize how dirty people are, how we have bacteria on our bodies to live, or we wouldn't be living. We'd live in a bubble. We have to have bacteria on us, but it's one thing when you're spreading it and you're germing it up and you're sneezing on people and you're coughing and kids too. But I mean, like adults, stop, you got your hands to your face and you're touching a doorknob, then you want to touch your nose and scratch the inside of it or pick something out of your tooth. Stop. I would have to say stop. I think that there are some good things that have, I don't know, I look back and I think all the life that has been lost. And I have a deep, deep sadness for people, the families that have lost lives, myself included, who it feels like I went through a traumatic point in my life with dealing with all that. But I feel like there is so much to be learned. It's the whole saying that you take lemons, you make the lemonade out of lemons. And I firmly believe that we as humans, we have to be wired somehow to find good out of the bad, to live in this world that we're living in. And I believe that people can be much cleaner people in societies, and to learn to show grace to people. Stop being so hard on ourselves and our lives, and let's live, let's be present and learn to be more thoughtful. And I'm hoping that comes out of this too.
So I was going to ask you to tell us what you would want to say about that. So that was okay. So we are now in, thank goodness that was, we have moved somewhat away from the overwhelming death. But now we're also in a place with Omicron that it's significantly, it's much more easily spread. And so then, but okay, I mean, we discussed before coming on, but okay, so great, it's easily spread. People aren't nearly getting as sick. So what do we need to worry about? And what is it? Who is getting sick with Omicron and getting really sick, and who's not? And where are we now?
Yeah, where are we now? Everyone is getting sick with it, especially the pediatric population. If you've been watching the news, the hospitals are being hit hard. And just the same adult population, the elderly, the immunocompromised, people are getting sick with it. Many are being hospitalized with it, just not dying from it. And that's a good thing. However, you still need to protect yourselves. We still need to wear masks. And, I've had people ask me, well, if everyone's going to get it, why are we testing for it? Why are we doing things? We still need to protect our community. We need to protect each other. We need to protect the people who are at highest risk. And that just comes without saying. I mean, we are still in a virus. We are still in a virus. I think when a lot of states, countries even lifted mask mandates and travel bans and allowed such free access again, we as humans tend to get this sensation of relaxation. Let's move about. Let's now live our lives again.
We're safe.
Holidays. Yeah, we feel safe. I won't lie. I will say that there were moments in time where I felt safer again. I was like, okay, I do feel safer again. But then yet we have the holidays, and we were warned. And yet we have the holidays, and we did the family gatherings and without the mask. And then the events, the social events came back. And the next thing you know, this is where we're at. It's not that the public health wants to go out and say, we are not preaching to people to get them to do what we want them to do, to order them around. What's happening is that what the public has to realize is when you get super sick with something like this and you're hospitalized, you're overwhelming the hospital systems. We have staff that are going out with it. It's like being a teacher. It's like teachers, they're getting sick with it. You don't have anyone to teach your child, right? So when you are just spreading it and you overwhelm the hospitals and the healthcare systems, there's no one to take care of you. The staff is cut short. You're not getting the best quality driven care that each and every one of us deserves. So
this is an important piece here too, though, is that who is it winding up in the hospitals really sick?
Honestly, it's everyone. It's not just a set stereotype. It's all different age groups, 20-year-olds, 30-year-olds, 40-year-olds, 50-year-olds.
But there is, when we discuss this coming on, that's why I'm pushing this, is that there is a common denominator in most of them. And are we allowed to draw this line that?
I think the common denominator, what we are hearing about is most of these people have had like asthma, COPD, upper respiratory issues, because this particular variant is more upper respiratory. It's more all related to what people believe to be the cold, sinusitis. It's presenting with symptoms of cough, sinus drainage, headache, body aches, your typical flu-like symptoms, to be honest. And then, so still the people that have immune issues and then maybe upper respiratory issues, but we're still seeing people that are getting really sick from it that don't have those common denominators.
And within that, so the piece I'm trying to address, so people that are vaccinated versus not vaccinated, what are you seeing between the two groups?
More illness in the non-vaccinated group. More
And
illness
is that
than
overwhelming? And can you, are you, as a professor, as someone that does studies, is that absolute data that you're seeing that separation now?
Yeah, it is. And I think what it is too, is the people who are vaccinated that get it, it's very mild. Some of them don't even know they've had it. And maybe they're getting tested because they have symptoms and they're worried about giving it to a family member. But for the unvaccinated, I think it's hitting much harder. And the reason we know this is because we as providers, we chart in the EMRs that we have, that when a patient comes in and you're taking their past medical history, you're talking to them and you ask them, have you been vaccinated for COVID? And the answer is no. And you're charting no. So it's something for scientists and researchers to follow, especially if you're doing retrospective chart reviews. You can look back and you can start to gather data from a large group of people and find out how many were vaccinated at the time they got positive and how many were not. And we're seeing a lot of unvaccinated. And I think that could be a reason to pause it and say, why the younger kids now? Well, the vaccine is only good for an age group and up. And so, you know, the younger ones, the pediatric, I mean, I have a daughter who's 8, she's vaccinated. But a lot of younger, they can't get the vaccine yet. The CDC hasn't recommended it. It hasn't been approved.
And we're just starting to move into that 5 to 11 space up until then. And then up until then, kids don't get sick, right?
They get sick with their typical childhood illnesses, but they were at the beginning of this virus, when it first came about, I should say, the children were somehow exempt. And I'm not going to say they were all exempt, but it really wasn't their virus at the time, nor pregnant women. Now I'm hearing of a lot more pregnant women getting sick with it, as well as after getting the vaccine, having rashes and just different things occur. So it's interesting. I wish that because I'm certainly a person that likes to figure something out and make it concrete, because I'm a little A-type like that and I want it to be there and don't change it, but I can't. This is nothing that you can do that with. So it's out of your control. So then you just have to figure out a way around it and how to cope with it.
Okay, so then one other piece here too is that, so people that are unvaccinated, right, are still leery, right, about that you've seen patients who are sick and recover. Are they still, is there still residual ailments and that is it still affecting their life after they've gotten out of the hospital? Hold on, my computer's not plugged in. Okay, everybody, hold on a second there. Wow, it's good because it's here. It just didn't feel like being plugged in. Well, that's good because we didn't lose anything, and here we are, and
Okay.
this is life. So,
But-
with that question though, are people walking away with the saying, "Hey, now I have immunity, life's good"?
Some that are actually lucky that they had the illness, got over it, seem to be back to 100%. Others, no. Others who have a long recovery, whether it's respiratory recovery, whether it's cardiac recovery, renal. There was a lot of information about the virus causing cardiac issues, especially in young boys, but in adults as well. Palpitations, arrhythmias. So I think that and we really don't know the long-term trajectory of the comorbidities of this virus at all. We have yet to study 10 people 5 years out, 10 years out. So we don't know the damage that this is going to do mentally. I should say, respiratory wise, heart wise, musculoskeletal wise, immune wise. We don't know. We don't know.
So, and again, we are definitely talking the mental toll, that the society, but your frontline workers, what do we get to do for them as you standing as being one of them, as we're going to get into the title of the book, and how great Cathy is for bringing this forward. With that, what do you guys need now? Where are we as a society saying we get to serve you now too?
That's a really good question. I am not sure where we're at. I can only speak for myself and maybe cohorts that I practice with and know. I don't know what all of medicine needs, but I will say that we need grace. We need love and understanding. We certainly need people to understand that we are scared and burnt out as well, and that we are coming out of this with mental discord as well, whether it be PTSD and just trauma from seeing so many illness, seeing so many people die
So much death
and debilitated from it. So I believe for me, I've thought deeply about where I want my life to be, how I want to live my life. What does it look like? Because I always say we're given one shot on this earth, so make it the best you can. And I believe, I hope that for most coming out of this virus, whether you were impacted by it physically or just from friends, families, or just watching it on the news, that you learn to take on a new aspect to your life and learn to embrace and accept and love and cherish and not take away negative. I believe in taking away the positive. So I feel like looking forward, I hope that in medicine, we learn to do things better. I feel like we could have done, whether it's getting on top of the PPE, having enough of it, whether it's how we learn to, at the beginning of the virus, when these people were getting sick, we were intubating them right away. We were sticking breathing tubes down them right away, thinking that was going to save them, because we were treating it like it was your typical adult respiratory distress syndrome, ARDS, and that's how they presented. But what we didn't realize until the studies came out from, Italy and all these other countries that were going through it sooner, that, and more deadly at the time, that we were killing, these patients were dying because they probably shouldn't have been intubated so quickly. They probably should have been able to ride the BiPAP or the, wave to see if their respiratory was going to recover. But in medicine, we're taught to save lives. So you just want to jump on someone and make sure they're breathing okay, but maybe that's not what they all needed. And you look back in hindsight and say, okay, let's learn from this, whether it's in simulation or I fully hope that our country, especially, and all other countries, can prepare. Now that we're in the thick of it, let's look at things and see if we can safeguard things if there is ever a next round of a different pandemic in the world that we live in.
That brings up to my next question then. So are we in the 100 years and we won't see anything for another 100 years, or are we in a new place of pandemics, of viruses, are we charting uncharted territory?
Yeah, this reminds me of the book by Sonia Koshnik. This reminds me of a terrible book, not a terrible written book, just a book that really scares you when you read it. And I believe, and I hate that I have to say this, but I firmly believe we're in a new world of mutations and viruses and the unfortunate. And I don't feel like, I feel like we would definitely see another pandemic before 100 years. Like, this pandemic came way too soon. And that's what we talk about. It's because we're living longer. We are overpopulated in areas. we are living differently. We are not taking precautions like we used to. I feel like our economic system, our epidemiology, I mean, there's so much that has changed for the worse in our world. I know people talk about going green, and we're always trying to save the environment and do what we do. And there's a very good reason for a lot of change in what we need to do. I think that it all comes down to affecting population health. And I think that as we continue to live and grow longer and are in tight areas and with each other and have the healthcare systems that we do, we're going to encounter more things. And sometimes they're going to be deadly. And I don't know if they're going to be in my lifetime, but I know that they're going to be here. So I just hope that it's so few and far in between.
Let's get into the project that you're both working on. And then Cathy, in addition to the Rising with Resilience, Karen gets to come out with her own book, but I'm sure you got this covered. So, okay, Cathy Davis is Davis Creative. What she's brought together is, again, a woman who's always bringing just the best topics that are right there in our forefront. Her last was Truth with Ruth Bader Ginsburg. And now her latest compilation of authors, which Dr. Karen Scaglione is part of, is Rising with Resilience. And it launches in, are we talking March now?
May
May
25th.
Tell us about the book, Cathy, your inspiration, how you keep bringing us forward with such amazing topics and going there.
Well, the conversation actually started with Karen and myself. We originally met on another project. She was in another one of our books, and she came to me with this idea. And I had heard about a book that a group of doctors put together in Italy, because as Karen mentioned a little earlier, they were at the forefront. It hit there first before we really saw and got to experience what they were experiencing. And with this book, our hope is that it gives people who have been involved, whether they're in the medical community, whether they're in the grocery store, as Karen mentioned, whether they're, I've heard a lot of people talk about their daycare, and how sometimes they can't get their child in daycare, or their child has been sent home because everyone's been exposed. Everyone on this planet has been affected by the last almost 2 years. And my hope is that this book allows the people that want to be involved to share their voice, to talk a little bit about what they've been through. And at the same time, that silver lining, what are the lessons that we're learning? What is it that we can carry forward if this is our new norm? And it doesn't matter whether, I know it's part of it is also opening up the opportunity for people who have lost someone to tell their story and what it's like being on that side of knowing someone so close to you that you now miss a whole lot.
So the book, whenever you're writing one of your amazing books, there's a flow to it. And I know that we'll get into allowing those that want to participate, how they can do that.
Mm-hmm.
So the flow of the book, or the segments, what does that look like when we get to promote this book, when it comes out as well? Where are you moving the book? Are we at that point?
Well, at the basics, if someone wants to participate, it's a 1,500 word chapter. It allows you to participate in a global marketing campaign that you might not otherwise be able to participate in. You join this community of other people who have had similar experiences, and you'll be getting to connect with anywhere from another 30 to 40 authors and learn their stories. And you become very close with this group because you're moving through the marketing campaign, you're moving through writing your program, your chapter. We have a writing coach that helps you write the chapter. And then everybody comes together at the end, and it culminates in this huge global marketing campaign. And all of the authors are able to walk away with the added credential of being an Amazon bestseller, which is always fun and exciting.
And we'll get to see that coming in because I'm going to get you guys in anyway as it comes forward. So I can't wait with that. So when you two were sitting down with this, where do you want the reader to, or what do you want the reader to get out with this book? What is the absolute purpose, and what can they walk away with?
What I have noticed a lot in the last 20 months, and we've done several of these books in the last few years to create community, is that people right now are looking for that hope and looking for community. Those seem to be two common denominators. Whether you're participating in a book, whether you're just going out for dinner, whether you're trying to figure out a way to organize a happy hour in your driveway, which is something we've done in the last couple of years, is get our neighbors together. We're all sitting 6 feet apart, but we find a driveway that's big enough to hold us. People need that community. And I think that's one of the things that we've lost in the last 20 months, or maybe we've gained new ways of looking at what that community is and how to rebuild it and how to remold it and what is this new community. But more importantly, I think for me, and Karen, feel free to chime in here, is that one of my goals is to offer a sense of hope. We've been through shit, people, and I don't know that it's over. None of us have that looking glass to be able to tell what's next, but I think I've become stronger. Sure, I have my days where I go, okay, I'm done. We can stop playing this game for a while today. I'm done. But then it's like you pick up and you go on, and it's like, okay, we're going to just keep moving. And that's what we do, is we just keep moving. And on the days that we're down, hopefully we have people that help build us back up. And on the days that they're down, then we're there for them to help build them back up. And that's what a community is.
So,
No, I wholeheartedly agree. Cathy hit it on the head. I mean, it's about community. It's about hope. My biggest vision for this book was to open the door for the community to hear us as healthcare, providers, and what we've gone through, and why we decided to practice medicine, why we wanted to go into, doing what we do, and to let them see that we're human as well. And then I feel like writing is so cathartic. I feel like writing and reading are things that pretty much everyone loves to, likes to be involved, either reading or writing or both. And I feel like these books are healing. This book is about healing and allowing and helping people to heal too.
I know a really good example of, I was in California right before Thanksgiving for a conference, and one of the Uber drivers that I got, just immediately you felt at home. Immediately, he handed you his card, and he even said, I'm alone all day, and my guests in my car are my community. And that just struck me, because I thought, oh, wow, I wish I had a way. Maybe if I go back into my receipts, I might be able to find a way to track him down to see if he'd want to write a chapter, because he was talking about, that's all he does. He sits and he's quiet all day, and then he picks up these people. And he said it's important for him to start a conversation with everyone that gets in his car. And I thought, wow, how many people actually consciously think about that and do that? And it was a lovely ride for me, because I got to learn all kinds of stuff about this new friend in my life.
So this book is about bringing everyone back together.
Definitely.
Absolutely. And rising through, I think, when we developed the title, it's about rising through what Cathy said, the crowd. It's about rising with resilience. It's about it's about coming up to the top again, getting through that, and knowing that the sky's the limit. There's light up there, and we're there.
We can be the phoenix. We can rise again. Yeah.
Okay, so let's say it's, again, Rising with Resilience. Cathy, it's coming out May 2022. How can, if there's others that are called to be a part of this, how can they get involved? How can they find you and be alongside Dr. Karen?
The easiest way is just to email me at Cathy, it's with a C, Cathy@daviscreative.com. That's the fastest way to get information about the book. And we'll make sure you get information and share all of our other lovely insights with you. And we'd love to meet you and have you participate in it.
Okay, but now time is always of essence. So when is the cutoff date, Kathy? When are you
So
like
we are
going into editing?
It's curious because the editor was asking me that this morning too. So when are we doing this, Kathy? So our final date for reservations is April 1st is when we want your last date for reservations. And then we can promise to get you in the book.
You're so tough. I love you, Kathy.
Yeah.
Mind you, most others, it's 6 months closed out. That's it. You're such a warrior. Okay, so everybody rising with resilience. It's all about frontline workers. Cathy Davis Creative, Cathy Davis at Davis Creative. If you're called, step up in the book. If not, we'll be launching it. I can't wait for that. And again, Dr. Karen Scaglione is part of this. Also, there's another book. Was the True Grit, right? Is that the other?
Yeah.
Is your, as you're here in this world of publishing, is there a book in her, Kathy, that you're pulling out?
Oh, definitely. I know, Karen, you have lots of ideas in there. And as much as I see how you help other people, I'm sure that the ideas are stirring in there for an upcoming solo book of your own.
I've always wanted to write. I've always wanted to write a book about medicine, but just in general now, a book about life. But I luckily am fortunate to know Cathy now and to have someone who's just such an expert in that field and being able to do that.
Yeah.
And that has been my guide when, coming and talking about wanting to do this. And this is going to be an amazing book. And so, yeah. And
it's very important for me to, at the core of everything I do is to empower women, help us find our voices. And then it's my job to help us share them.
Yeah.
And on alliance with that, because again, you're in my house of cards. Karen, you're now a new welcome member that I'm looking forward to getting to know more. I will see you guys and more of Author Summit for the launch and thereafter. You guys get to come back.
We'll be back.
I would love to be back.
Okay, good. Everybody, again, Rising with Resilience. Contact Cathy at Creative Davis, and it's Cathy with the C. All right, everyone. Thank you guys for coming on.
Thank you, Maureen.
Wonderful.
Thank you, Maureen. Thank you.